Good morning, my name is Marie-Therese Anwander and I'm a cardiology resident of the University Hospital in Bern. I'm pleased to present you our abstract Increased Failure Rates of the Microport, formerly Sorin Beflex and Vega pacemaker leads, compared to the Medtronic CapSureFix Novus 5076 lead. It is known that lead-related failures are relatively common and exhibit various mechanisms. And based on our clinical observation of several index patients who experienced complications with Microport, Beflex and Vega leads, a survival rate of over 99% seemed not to reflect our experience. So we aimed to compare those leads to the Medtronic CapSureFix Novus 5076 lead to analyze their real-life performance. In order to do so, we analyzed the performance of all Microport and Medtronic leads implanted at our center between January 2014 and January 2018. All interventions were performed by electrophysiologists. Only de novo right atrial and right ventricular lead implantations were considered, and lead failures were defined as any lead issue requiring re-intervention, such as lead dislocation, cardiac perforation, electrical abnormalities such as lead noise, or high pacing thresholds. A total of 382 Microport and 203 Medtronic leads were included. Mean patient age was 75 years and median follow-up time was 20.4 months. In the Kaplan-Meier analysis, the overall failure rate of the Microport lead was significantly worse compared to the Medtronic lead. Cumulative failure rates after 2 years were 6.3% in the Microport group versus 1.5% in the Medtronic group. There were about 60% electrical abnormalities in the Beflex Vega group, 16% perforations and 9% dislocations. In the Medtronic group, there were 50% perforations, about 30% electrical abnormalities and 17% dislocations. To sum up, the observed performance at our center does not reflect the performance reported by the manufacturer, and moreover it is significantly worse than the one from a competitor electrode. But why? We don't think that it is because of patient or implanter-specific factors, as our patient characteristics of the two groups were not different and represent a typical cohort of pacemaker patients. Also, the complication rate of the implanters with the CapSureFix Novus 5076 lead did not differ from the published lead failure rate of Medtronic. What is crucial to note is that the definition lead failure used by Microport is not the same as our definition, since Microport bases its survival estimation solely on the analysis of returned devices. Now, as patient or implanter-specific factors are largely ruled out, we believe that differences in lead design are responsible for this effect. Although lead design is very similar, Beflex and Vega leads seem stiffer, which may favor dislocation or perforation. They also have a less extendable screw for active fixation, which again may favor dislocation. Finally, also the number of noise oversensing episodes, which is often caused by isolation defects, was higher in the Beflex and Vega group, which may imply that those leads also suffer from accelerated isolation fatigue compared to their competitor electrode.